Chapter 4: Managing and Treating Major Disorders. Medication, a useful strategy that is here to stay. As a case manager, you will undoubtedly encounter children and adolescents who are taking medications to support their mental health. Medications have become an essential tool in treating behavioral disorders. While medication is rarely a standalone solution, it can help stabilize behaviors and moods, allowing other forms of therapy to be more effective. Although a case manager is not a psychiatrist, it is important to have a basic understanding of the medications your clients are taking. Case managers are often in the best position to inform the psychiatrist when a medication is not working or is causing serious side effects. This is because case managers frequently interact with individuals taking medication, often more regularly than the prescribing psychiatrist. The use of medication for children and adolescents with behavioral disorders is not always as precise as we might hope. Traditionally, these medications have been developed for, tested on, and marketed toward adults. Due to potential risks, children and adolescents are generally not included in treatment trials, leading to a trial-and-error approach to medication management. Psychiatrists may try several different medication combinations at varying dosages before determining the most effective regimen. This process can be frustrating for the individual taking the medication and for their family, who may expect quick results. More often than not, the initial combination of medications will require adjustments. As a case manager, you can support the individual and their family by reassuring them that this process takes time and that the potential benefits are worth the effort. Encourage the individual to stay attuned to their symptoms and any changes they experience. Additionally, remind families to report any concerns to the psychiatrist. Case managers play a vital role in recognizing and identifying medication side effects. It is important to understand that all medications, whether for behavioral health or other medical conditions, can cause side effects. Some side effects may be minor annoyances, while others can be serious or even life-threatening. Encourage individuals and their families to discuss any side effects with their psychiatrist, as there are often ways to manage or mitigate them. If you notice a significant side effect, prompt the individual to see a doctor immediately to prevent long-term complications. Additionally, encourage families and individuals to educate themselves on potential side effects so they can identify concerns early. Although case managers play an important role in supporting medication management, they are not medical professionals. You should never be responsible for making medical decisions about which medications an individual should take. Maintain open communication with the psychiatrist if you notice side effects or other issues, but remember that the final decisions regarding medication rest with the prescribing doctor. This manual provides brief descriptions of various medications and their potential side effects, along with strategies to help individuals maintain a consistent medication regimen. Attention Deficit/Hyperactivity Disorder, ADHD, medications. There are two major categories of medications prescribed for ADHD, stimulant and non-stimulant. Stimulant medications, such as amphetamines and methylphenidate, are the traditional treatment and are considered highly effective. The only FDA-approved non-stimulant medication for ADHD is atomoxetine, Strattera. Non-stimulant medications are typically prescribed when stimulant medications are ineffective or produce undesirable side effects. Below is a table of FDA-approved ADHD medications. Trade name. Generic name. Adderall. Amphetamine. Adderall XR. Amphetamine, extended release. Concerta. Methylphenidate, long-acting. Daytrana. Methylphenidate patch. Desoxyn. Methamphetamine. Dexedrine. Dextroamphetamine. Dextrostat. Dextroamphetamine. Focalin. Dexmethylphenidate. Focalin XR. Dexmethylphenidate, extended release. Metadate ER. Methylphenidate, extended release. Metadate CD. Methylphenidate, extended release. Methylene. Methylphenidate, oral solution and chewable tablets. Ritalin. Methylphenidate. Ritalin SR. Methylphenidate, extended release. Ritalin LA. Methylphenidate, long-acting. Strattera. Atomoxetine, non-stimulant. Vyvanse. Lisdexamfetamine dimesylate. Side effects. Stimulant medications. Common side effects include reduced appetite, weight loss, sleep disturbances, headaches, stomach pain, and irritability. Non-stimulant medications. Common side effects include nausea, reduced appetite, weight loss, drowsiness, and irritability. While these side effects are usually not dangerous, they should be reported to the prescribing doctor. Serious side effects can include heart-related issues, hallucinations, suicidal thoughts, liver problems, and worsening of pre-existing mental health conditions. If an individual experiences faintness, dizziness, unusual heart rhythms, chest pain, or shortness of breath, contact the doctor immediately, as these symptoms may indicate a heart condition. If taking Strattera, report symptoms such as itching, upper abdominal pain, dark urine, yellowing of the skin or eyes, or unexplained flu-like symptoms, as these may indicate liver problems. Antidepressant medications. Antidepressant medications are commonly prescribed not only for depression but also for conditions such as anxiety disorders, obsessive-compulsive disorder, post-traumatic stress disorder, eating disorders, and ADHD. These medications fall into 4 categories. Selective serotonin reuptake inhibitors, SSRIs, Prozac, Zoloft, Paxil. Atypical antidepressants, Wellbutrin, Remeron. Tricyclic antidepressants, TCAs. Elavil, Anafranil. Monoamine oxidase inhibitors, MOIs, Nardil, Parnate. SSRIs and atypical antidepressants are the most commonly prescribed due to their effectiveness and lower incidence of side effects. TCAs and MOIs are typically used and other medications prove ineffective. Side effects. SSRIs and atypical antidepressants. Common side effects include headache, nausea, drowsiness, agitation, and reduced libido. Tricyclic antidepressants. Side effects may include dry mouth, constipation, bladder issues, blurred vision, and drowsiness. MOIs. Individuals taking MOIs must avoid foods containing tyramine, e.g., certain cheeses, wines, and pickled foods, as it can dangerously elevate blood pressure. A critical concern with antidepressants in children and adolescents is an increased risk of suicidal thoughts. The FDA has issued a black box warning for all antidepressant medications due to research findings that, in some cases, these medications can lead to increased depression and suicidality. Close monitoring is essential, particularly in the first few weeks of treatment. Warning signs include worsening depression, increased suicidal ideation, or behavioral changes such as agitation or social withdrawal. Families should be encouraged to report these symptoms to the prescribing doctor immediately. By understanding the role of medications and maintaining open communication with both families and prescribing psychiatrists, case managers can play a crucial role in supporting individuals through the complex process of medication management.